COVID taught us a very tough lesson, that no country is safe, regardless their level of economic development. But the conditions of developed and developing countries are still very different.
Hello, this is the weekly Tradecast podcast brought to you by UNCTAD, the UN's trade and development body. I'm Sarah Torrance. We're exploring how major events are shaping trade and development and how that affects billions of people around the world. This week, we're looking at the urgent need to invest much more in healthcare. Hundreds of millions of people globally have little or no access to essential health services. Improving their well-being is vital to support economic growth and to help to achieve the Sustainable Development Goals. But for many countries, there's just not enough money to build up the medical facilities, supplies and staff that their people need. These issues have become even more pressing with the COVID-19 pandemic and the cost of living crisis, exposing vulnerabilities. UNCTAD's World Investment Report says at least $100 billion in extra healthcare investment is needed every year in developing countries alone. Well, where will that money come from? And can we succeed in ensuring greater and fairer access to healthcare? Well, to answer all these questions and more is Bruno Casella, an economist at UNCTAD working on international investment and sustainable development. In previous lives, he was a mathematician and executive consultant. Bruno is passionate about numbers, multinationals, and playing football. Well, thank you for joining us today, Bruno.
Thank you, Sarah.
Why is healthcare treatment so important, and how do the needs differ between developed and developing countries?
A streetwise person would answer to this question. When there is health, there is everything. Interestingly, the popular wisdom has a counterpart here in economic data and analysis. So in our World Investment Report and also in our UNCTAD SDG Monitor, we have been tracking for quite some years now investment into SDGs.
Sustainable
Development Goals, of course, yes. And so more specifically, we have been looking at the number of international investment projects in SDG sectors. Now, if you look at the trend of investment in Sustainable Development Goals since the start of the 2030 Agenda, so we are talking about 2015, you see that they have been growing. They haven't been growing fast enough, and that's a massive challenge. There was just 1 year when they dramatically fell. And guess what? It was 2020. It was exactly during the pandemic. They went down 30%. If we want to achieve the SDG by 2030, we need to find for developing countries additional 4 trillion investment per year from now to 2030. Now that implies a massive acceleration in investment into SDGs. So from that perspective, the world cannot afford a disruption in investment to SDGs like the one we have experienced during COVID. Another COVID would mean giving up with any hope to rescue the SDGs. So that's why investment in health is very important. COVID taught us a very tough lesson, that no country is safe, regardless their level of economic development. And I'm originally from Milan. So Milan has been in Europe one of the epicenter of the COVID outbreak. The Italian healthcare system, which is by many dimensions one of the best in the world, was just collapsing. You could hear doctors saying they could have saved much more lives under different circumstances. This is a shocking statement for us in the developed world. But now my question is, as shocking as it was an emergency, confined in some sense in time and space. But there are every day in the south of the world. There are countries where still in the sub-Saharan Africa, 1 in 100 women die by complications connected to maternity. So if we go beyond the cold numbers, 1 in 100 is shocking. COVID made the world a little bit more similar in terms of how we can cope and our vulnerability to health crisis. But the conditions of developed and developing countries still very different. In poorest sub-Saharan countries, per capita expenditure in healthcare per year is $20. That means that each person consumes $20 of healthcare service per year. The average of developed economies is $5,000. So that gives you the staggering difference.
The amount of extra funding needing for developing countries is staggering, as you said. But if that money were to appear every year, that $100 billion US, how and where would it make a real difference?
Let me start by giving you bad news, that the problem is much bigger than the $100 billion. Because $100 billion, which is one of our latest analyses, refers to the funding of physical assets that are what we call capex. That means land, building, machinery, technology. So it's a part of what is needed. So one is healthcare facilities. The other is medical equipment. And then you have logistic infrastructure. Very often in developing countries, the problem of urban area. There are the facilities, but they are outdated. And of course, nowadays, not all the healthcare delivery needs to be done physically. There are many options that, for example, telemedicine offers. But even there, you need investment in infrastructure, in digital connectivity, in power connectivity, in data center. And then you need also to invest, for example, in laboratories where you analyze the sample of bloods and stuff like that. So this is the first category of expenditures that you would need to do. The second is medical equipment. Remember, what was the most important and most demanded life-saving asset during COVID? It was ventilators. Like many other things, for example, MRI machine, magnetic resonance, that is very important to detect disease or to monitor the progress of diseases. The third category is logistic infrastructure, ambulances, helicopters, to really reach all area. But these are the three main categories where we would need to spend the 100 billion if we had them. And here we get to the other big component of the missing investment. You need to fill in the hospital that you build with doctors and nurses. That's not capital expenditure, it's called operational expenditures, but it's at least another 150 billion for developing countries. And the patients in hospital, they consume medicaments, which are very expensive. That's at least another 90 billion. So we have calculated that all together, if we put together everything, so the capital expenditure, the operational expenditure part, is $400 billion that are needed every year in developing countries alone.
With multiple crises hitting the world right now, how can we hope to raise that kind of money that you're talking about for healthcare, though?
This is, I think, the 100 or 400 billion question. Developing countries have two problems. They don't have enough money to spend in public services. The second problem is that the poorest one, especially the LDCs, they don't have indigenous private capital that they can tap in. Or at least a big part of the solution must come from outside, from international capital. But even there we have a problem, because even developed economies, they now have very tight budgets. So it must come mainly from international capital that is private. Technically, that's called foreign direct investment. Unfortunately, it's not so easy, because investment in healthcare requires a lot of capital. So it exposes to quite a lot of risks. When you invest a lot upfront, you are also exposed to risks. We calculated that the first biggest 5,000 multinational, non-financial multinational, they have cash holding, meaning money that can use right away, of 8 trillion. There is a lot of money that can be spent, but right now that money is dormant. So we need to find a way to wake it up and to channel where it's needed most and in the most beneficial area, which is SDG sectors in developing countries. And how to do that, there is no secret recipe. And I think that multilateral organizations like UNCTAD must play a role in that, in stimulating this capital to go where it's needed. So both international investment policies and national investment policies, they should be conducive to an open environment for capital flows and be geared towards those areas like SDGs that are more beneficial. The solution must be cooked in multilateral kitchen. So we cannot leave this to each developing country to sort out because, as we said, they just don't have the ammunition to target the goal. It needs to be cooked in multilateral and regional form. So it's a problem. It's everybody's problem. You need to package it in such a way that they attract investors. So, for example, through risk-sharing agreement between the public and the private, to public-private partnerships, to project financing type of package. So we need to be flexible and creative in thinking what's the best way to attract this private capital in healthcare. And finally, we need that all relevant stakeholders are fully aligned.
Thank you so much, Bruno.
Thank you,
Let's
Sarah.
leave it there for today. That was UNCTAD's Bruno Casella, who was this week's guest. Tune into the weekly Tradecast next week and every week for more insights on the most pressing issues around the world of trade and development. And there's even more on our website, unctad.org. I'm Sarah Thomas in Geneva. Goodbye for now.